in infancy, some of our typical like telltale signs are going to be nursing issues. If we are nursing, could be pain for mom, could be supply issues, could be that we're really gassy, spitting up often, not happy, like a colicky baby is what some people would call it. If we're bottle feeding, maybe we're hearing lots of sounds on the bottle, we're leaking lots of milk, we're having the same tummy issues of spitting up, gassiness, constipation, all of those kind of things can tell us that there's something going on, whether it's ties, it's just muscle dysfunction, it's tension in the body, combo of all of them. Typically, it's a little bit of a combination of things.
Hello, welcome back to the Integrative Health Podcast with Dr. Jen. Hello. Thank you to everyone who has been sharing and leaving reviews. So excited that we are reaching more and more people because of that. And today, very important topic. And if you're a mom out there and don't know what to do for your kids when it comes to their teeth, you need to stay tuned. Today, we have Chelsea Madison. She is registered dental hygienist. She's double board certified in orofacial myologic, aka myofunctional therapist. So that is literally, I need my tongue to be working better to say all that.
Yes.
International board certified lactation consultant, infant oral motor specialist, and craniosacral facial therapist. So she even deepened her expertise more and became certified through the Academy of Oral Facial Myofunctional Therapy and earned an additional certification from the Graduate School of Behavioral Health Sciences through Coulson Institute for Oral Myofacial Myology. And she's just going to share all her certifications and all of her knowledge today. But why did she become certified in this? And we're going to get to this. So first, Chelsea, welcome to the podcast. So excited.
Hey, thank you. I'm so excited to be here. This is a huge passion of mine, and I love spreading awareness and helping people because it still feels like it's this niche thing, even though it has been around for quite some time now. I just think it's so important to share the knowledge with people. So my first degree is dental hygiene. So I hold a degree in that. That was my first and kind of like starting point, which I don't regret. I still hold it. It's active. I still do all my CEs for it. Something that was really close to my heart. And I worked very hard to hold that degree. So I keep that active. And that kind of opened it up to where I am now. So I first was working with a dentist who started doing oral tie releases. And it was very noticeable that doing the tie release itself was not fixing everything. And that's kind of what we thought in the beginning was we do the tie release, everything's going to be better. And we were just really noticing that that was not happening. So we learned that there is such a big muscle component to it. And I started getting training in about 2016, 17 for actual myofunctional therapy. And prior to that, we were already doing tie releases. I'm very familiar with that, understanding the ins and outs and all of that kind of stuff. And it kind of led me down this path for myo itself. So did my first intro course, was kind of iffy on it, to be honest. I was just like, this is so different. Right? Like this is how did I not learn any of this when I was in school for 5 years when I got my first degree, right? Like it doesn't make any sense. And it took me some time and continuing education to really dive into it. And that's when I first did the first certification through the Coulson Institute, which is the Graduate School of Behavioral Sciences. And I really learned so much about it.
And I think it's important. Like a couple of things that you have said is that you were a dental hygienist and you're like, how have I not heard about like why this is so important for the body? And you're like, because you already went to school for all that time and then you have to do more. And that's how I felt with medicine. And you get out and you're like, well, what and what? And this is why I want to have you on here because, you know, you like to grow beautiful faces, right? But it's not just about beauty. It's also about function.
Yep.
And like, it's And just to be honest, like it's expensive. It's an investment in your kids to fix their airway and their teeth now. But if you fix their airway, you fix their teeth. And I just honestly, like driving home today from my kid's Alf device appointment, I had another like argument, you may call it discussion with my husband about like why we're spending money on this. He doesn't understand. And this is why we need to have more podcasts to like normalize all of this, because once you see, it's just crazy. And now you personally had something happen, like you went through something personally that sparked your interest.
Yeah. So my oldest is almost 11 now. And when he was born, of course, he was my first. So there was a lot that I didn't know and I didn't have good support. And
Right.
so he had all of the issues, all of the typical tongue tie, oral dysfunction, tension in the body, all of the issues that I just back then didn't really realize. The resources weren't there. People didn't know quite as much. It just was a battle. It was really, really tough. I totally felt like I got robbed of that first year of his life because we went
Yeah.
through so much. And that was a big part of why I wanted to continue to learn, because I was looking around, I was hearing these stories. So many of these stories were the same over and over and over and over, and people were just missing things. And
Right.
so I made it my life's goal to try to learn all these things. That's part of why I have so many different certifications. Like
Right.
I'm a hygienist. I have double certifications through two different institutes for myofunctional. I'm an IBCLC, International Board Certified Lactation Consultant. I went for training for craniosacral therapy because there's so much that's missing. And, as you guys know, and as Dr. Jen knows, the body is complex. Like it's not this little tiny box we can put stuff in. And just having that knowledge for me would have been such a life changer
Right.
11 years ago.
Yeah. What kind of symptoms like would your kids start to show? I mean, if you could walk us through from infant to up to like 10 years old, like how would you know that maybe they're having an airway tongue issue that they might need myofunctional therapy?
In infancy, some of our typical like telltale signs are going to be nursing issues. If we are nursing, could be pain for mom, could be supply issues, could be that we're really gassy, spitting up often, not happy, like a colicky baby is what some people would call it. If we're bottle feeding, maybe we're hearing lots of sounds on the bottle, we're leaking lots of milk, we're having the same tummy issues of spitting up, gassiness, constipation, all of those kind of things can tell us that there's something going on, whether it's ties, it's just muscle dysfunction, it's tension in the body, combo of all of them. Typically, it's a little bit of a combination of things. Those are our typical infancy signs. And then we move into solids. So maybe we're starting to have issues with solids. We're having to keep foods really, really small. We can't do tougher textures, meats, hard veggies, things like that. We're gagging, choking for long periods of time. And then we end up just being on soft foods or pouches. Then moving into mouth breathing long term or snoring, sleep apnea. I have 1 year olds that I see that already have sleep apnea, speech issues. There's so many different things that we can see. And the biggie, that's an easy one to see as we continue to get older into older child, is how we're sleeping and developing. So tossing and turning, mouth breathing, snoring, developing narrow jaws, which is causing some of those issues. There's this whole snowball effect that happens if we don't start early on changing how things are developing and working.
Yeah. And once you, oh gosh, like look back and you're saying all these things, and like my oldest son, the 13-year-old, like he had some of those problems as a kid. And like we looked for tongue and lip type, but it's not just like, oh, it's a release and you're done. Like you need the other things from it. And that's like where we were at in Northwest Ohio that was lacking. Like I don't know. Education is so important. And I think this is a problem with so many kids. And once you know, you can't unknow. And once you see, you can't unsee. So, like, the crowding of the teeth and all of that, like,
Mhm.
braces aren't going to help the tongue and the airway. Braces are just like making it look cosmetic. So, this is the argument I have with my husband again and again. And it was so funny. You'll love this, Chelsea. So, he got his airway eval today. And he is so tight. Like, I think he was like 37 millimeters. And my 10-year-old just graduated to maintenance for his ALF
Yeah.
and he's at 45.
Yeah.
So my 10-year-old, my husband's 6'4", and he has, high arch and narrow, his airway too. He has sleep apnea, right? So, I mean, this has started, wasn't breastfed, didn't know about all this, went all the way up and he had braces and everything, but it doesn't fix the root cause. So I guess like, let's get into like, what is myofunctional therapy? Because I'm still learning thing at every appointment. So Emery goes to Chelsea and I think it's so cool. Like I do the exercises with him because I am not using all of my muscles in my tongue. So like, I feel like the tongue is like such an ignored like part of the body, honestly.
Yeah. Yeah. We see it a lot. So, myofunctional therapy is kind of like physical therapy. So, we're using isolated exercises and targeting certain muscles in the muscle group or the oral cavity, kind of like this whole region here to accomplish something. So, I've been doing this for quite some time now. I'm a little bit of a muscle snob when I do stuff. So I'm very particular. And because I go through this like, hey, this is why we're doing this. This is exactly how it should be done. There are things we try to accomplish and we stack like a 6, 7 layer cake, right? So the tongue is actually a muscle group. So we have to break down the muscles and work them individually. And we have to start simple. Like we would never start building the roof of a house before we've done the foundation and everything that goes before we can do the actual roof. So we learn simple skills, creating new pathways from the brain to the body so that the body is just functioning differently. And then we add on those skills and we go through multiple phases of therapy in order to ensure that when we get done and graduate, we are functioning the way we're supposed to. We go through a comprehensive program and we are picky about everything to make sure that when we graduate, all we're doing is check-ins. We do check-ins periodically to make sure we're holding patterns. But if we're doing a full relapse after we've done a myofunctional therapy program, then something was wrong or something was missed. The thing outside of that would be trauma. So if there's a severe trauma that happens, that would be a little bit different where we have to kind of remake those pathways. But in general, if we are teaching the body properly, the body will be functioning at the end of the day. And that's the biggest question I normally get is, well, do I have to do these exercises for the rest of my life? No, we're teaching your body to function with everyday life skills, how we're chewing, swallowing, drinking, swallowing, resting posture, sleeping, all of those things become our exercises per se, so that we are functioning, growing, developing, thriving the way that we need to.
Yeah. Now, why does it matter? Like, how does a properly functioning tongue help our airway and help our swallowing and all of that?
Yeah. So if we get our tongue pressed into the palate with our swallow, just swallow in general, well, let's just go through swallow for foods, drinks, saliva throughout the day. Hundreds of times a day, we are swallowing and we are creating about 500 grams of pressure every single time we're swallowing. So people always ask, how can changing the muscles change what the bones are doing? Because yes, bones are harder, but muscle patterns happen more often. And so we can see that in the body, like somebody who's hunched over for a long period of time, eventually the bones start following that because that's what the body is telling the bones it should be doing. And so if we can reprogram what the brain thinks we should be doing, we create the pressure that's adequate for tongue space. And then we can even avoid braces, things like that in some cases. And so when I say that we want to grow beautiful faces, I don't even necessarily mean beauty in that aspect. I mean a nice wide face, like super open airway, symmetrical, all of those kind of things. Those are beauty. And I got really lucky today. This never happens. I had 3 really good consults with people with beautiful palates. I
Mm.
never see that. I am never blessed to see that. I always usually have them and they're narrow. We have to go through expansion, do all the things. In these cases where we developed, however, the muscles still are not functioning. There was
Mm.
other stuff going on. And so it's not black and white. There's a lot of gray areas where maybe they did develop perfectly
Right.
and we think the muscles are functioning, but then they come in and there's lots of areas that are inactive and we actually have some pretty big symptoms, even though the palate ended up being as wide as it needed to be.
Yeah, I always get frustrated because I breastfed my children so long. And my husband's like, why do we still need this? And I'm like, there's so many factors. So, I mean,
There is.
what are some factors like going through this with my son, like my tongue, I push it too far forward.
Mhm.
And, but just like, why? Like, why do we learn it this way? Why is our tongue need to be trained sometimes?
That's such a good question. So I don't know the answer of why, like where does it come from? We do know that in utero, we start having these muscle patterns happen. And we know that because sometimes we can see like thumb sucking on ultrasounds, things like that happening. So we know we're already learning those suck and swallow reflexes early on. I think part of it is probably when we do have ties and we have restrictions. And so it limits what range we have or how we even learn how to use those muscles. I think another portion of it probably is just that's how we learn how to use the muscles. So, an example of that exteriorly in the body as we get older is like running. Some people learn the proper way to run and use the muscles and all of that. And then some people just do not. And, they stomp really hard and all the things that they're causing other things happening just from running. That's where we start getting those compensations happen. So maybe that child did feed well, right? But really they weren't. There were signs and symptoms. More than likely we were compensating. And the number one thing that we hear is they'll grow out of it. Well, no, they don't really grow out of it. It changes into something else. So that
Right.
symptom that we had early on with breastfeeding issues, yeah, obviously we're not going to have that symptom when we're 12. It's going to be different, right? But it just turned into something else, whether it's snoring or teeth grinding or mouth breathing, whatever it could be, it just changes.
Yeah.
So we can tend to just like brush things under the rug if you bring them up to our typical providers that don't have training in it. And that's how things get missed for so long.
Yeah. And I think it's crazy. I was told with one of my boys, maybe it was Emery or Cyrus, that, I knew they had a lip and tongue tie. I knew to look for it because my sister is a lactation consultant. And they were like, oh, it's not that bad. If it's not painful for you, then just leave it. And instead, I should have been referred to myofunctional therapy. I should have been told to do cranial sacral on my own kids because I'm a DO. Like, I don't know. And it's so frustrating because I feel like, I don't know if it was a lack of knowledge or they didn't want to refer out. I don't know. It was very strange. And that's what sometimes I get frustrated in the medical field. It's like, we're not like truthful with our patients, like, oh, I'm not sure,
Well,
or let's refer you out or something like that. So why is a lip and a tongue tie why can't we just do that and then they're good forever, or 'cause
now,
that's what some of these dentists say. And it's just
yeah,
not what it is.
it's just not. So there's a lot of factors that I take into consideration when I'm seeing infants, even like what does tone look like? Do we have a really clear visual of that frenum where it's not all just kind of mush with the muscles? Or do we need to work on tone and make sure that we can really see that frenum and get a good release? Because that's a difference. Doing a release of what we can see without good tone versus getting good tone and then doing a full release is a completely different surgery. It's just completely different. And so a lot of people get really confused because they think that, Joe Schmo down the street can do releases for $500. Why would I go and pay $1,300 or $1,400 somewhere when it's the same thing? And most of the time, prices are going to reflect that person's background. That's just a matter of fact. Like if we are investing in ourselves as providers, typically our pricing goes up just a little bit.
Yeah.
And that provider that charges more probably knows to look for certain things before they are just doing a release, or they probably require that a myofunctional therapist or lactation consultant that's trained in oral motor therapy signs off and says that, hey, you can do this release. We're good. The body's good. The muscles are working. I think you have a clear path to do your job now to make sure that
Yeah.
we can get done what this person is needing. And,
Yeah. Yeah, I think that's a
there's a
great.
huge variation.
Yeah, that's a great point. Like, you don't want to bargain shop for your provider. You'll end up spending more and being more frustrated because that's like what happens. Like, get, I see those people and I'm sure you do too. And then
Mhm.
they're like even more frustrated and they've wasted more time. So, yeah, do not bargain shop for a doctor, for anyone for your oral health. Like, it's not. Look at their certifications. Make sure you can find their certifications and they're not like hiding them too. That's a whole nother thing. So yeah, and I think can you explain the different types of ties? So because there's lip, there's tongue, there's cheek tie, which I didn't even know about until Emery has them, my son. So it's crazy.
Yeah. So the most commonly known are the upper lip and then underneath the tongue. Those are the big ones
Yeah.
that people have heard about for a while now. Buccal ties or cheek ties have been around, and it's been something that I've actually been recommending to have released for quite some time now. But a
Yeah.
lot of people were like, there's no research that supports. Like, everybody wants the research, right? Which I understand. Like, I'm a medical mind also, but we have to realize where research is typically coming from. We want the research to back whatever money we're going to get in the end, right? And so some of this stuff is not going to actually be money at the end. It's just
Right.
for people to know. And so recently, I think within the last year or two, it kind of blends together now, we had some research come out about buccal ties, and we
Oh,
had
cool.
classification system come out where before
Okay.
it was basically like they're restricted or they're not. Now
Yeah.
we have a scale that we can use saying, 1, 0, 1, 2 is how that goes. Kind of like how the lip has a 1, 2, 3, 4 and tongue has a 1, 2, 3, 4. Similar thing. So now we've got that research. We can
Right.
even have lower lip restriction.
Mm.
There are many places where we can have that really tight fascial attachment. Just because there's an attachment there does not mean it's a tie. So a lot of people will post pictures and be like, is this a tie? And
Right.
some of them are, yes, very obvious. But we really need to look at function. Like, we need to
Yeah.
see how we're functioning. What is our true range of motion? What do we see in addition to what that anatomical tie, to really determine if it's something that we need to be releasing or preparing for, maybe releasing, really customizing to that person.
Well, the buckle tie, it's very interesting because they took pictures and I've never like looked, and at Emery's and you can see where there is tension and then it's putting like tension on the gums and into the teeth and like causing like separation. It's very interesting because it's that tight fascia and because like you can't really do anything for that. You can't really like stretch it or anything. So they just, cauterize them. And it's just really interesting when we look at all of these ties and tensions and pulling how it can cause dysfunction in the mouth. So what about like expanders? Why can't my son just go to a regular dentist and get one of those expanders that you crank on? Won't that solve all the problems and then they'll be free of sleep apnea and they'll be fine?
Yeah, this is one of the biggest questions that we get because obviously, when we're sending to providers who are highly airway focused, doing functional appliances, or maybe they are using a traditional or a variation of a traditional, but they're very airway focused, there are certain guidelines that need to be followed in order to have good airway space and good development. Most of those guidelines are not taught in traditional ortho or anything like that. So when they are expanding, they want teeth to fit. And that's basically it. They really could care less if the person's airway is super narrow or, maybe they even try to take out premolars, which like
Yeah.
is very rare now, very common for our age when we were younger, but some actually still do it. I still get people that have premolars removed recently. They just care about straight teeth. And then why did they develop that way? because of the muscle patterns, because of the fascia, because of all this stuff. So if we go straight to a traditional ortho or dentist or whatever, do expansion, they're going to expand us to an extent, and then we're not going to address the underlying issue. We're not going to address why we ended up being up this way. And that's a problem. That's where we get ortho relapse. That's where I see tons of adults that are like, well, I had an expander when I was younger. And they have the mouth of like a 3-year-old. I'm like,
Oh, geez.
well, maybe you
You'd
did,
regret it. Yeah.
but we lost some of that, and or maybe you didn't even get that much space. Maybe their goal was just to get the teeth to come in, and then they don't really care if you have huge black triangles on the side where your palate is narrow like this instead of your teeth filling up your smile.
Yeah. And that's so common. I mean, you can just look at people and see. And now, like I said, you'll look at people so much different now. I like coming from emergency medicine. I mean, we had scoring of people's airway, and we would hate it when we would get someone with a really narrow airway and a really tucked in chin, and they're like this, and they're so hard to intubate. So, because they're so tight in there. So, yeah, that's a risk factor if you have to get intubated ever, but it's not healthy. It means that the jaw is not developing properly. You want to have a nice square jaw, like the models, the GQ, but that nice chiseled jawline.
Mm-hmm.
And if we're just going for how the teeth look and straightening the teeth like traditional orthodontics, that is missing the boat. And no one ever talked about this. I mean, I just like today, I was like, praise God that like my 13-year-old got the movement, got the widening he needed before puberty, because I started a little later because I didn't know, I didn't have the information. Then I got cold feet for like 6 months because we had to drive 2 hours both ways. So it was like a 4-hour day of driving to get them in an ALF device. But then, even then, it wasn't like pushed hard enough, the myofunctional therapy. So I love that where we go now, it's like, yes, you have to do this. This is like part of it. It's not an option, because like you said, even with these, more specialized or, ALF devices, Prozac, that you could still have regression if their tongue is not working properly. Is that right?
Yep, exactly. And so with those, you go into a time where you'll be in a holding pattern, and depending on how old that person is and how close they are to like an adult growth phase, it could be longer than other people. But the really important things is that, kind of like I said, say I saw somebody when they did ALF initially, and they're only in graduation phase. So I'm seeing them maybe once a year, but I didn't do a good job. So what if, this is not true, but if I didn't do a good job and their muscles weren't cooperating, by the time I see them the next year for a check-in, they could have lost many millimeters. Like we could really be coming in because we're not getting the proper pressure in the places that we need it. And so it's so important that myofunctional, really any orthodontic case is a myofunctional case. It just is kind of how that goes. But especially when we're using any type of functional appliance, we have to have perfect muscle function and cooperation.
So with the tongue, is it like if you don't use it, you lose it? So say someone goes through intensive myofunctional therapy and then they're like in a holding phase for that. Do they have to continue to do these exercises, or because it's like gradual and building, they're automatically going to do it? Or how do we know?
So if I have somebody that goes through with all 3 phases, so the intensive phase, the habituation phase, the muscle memory phase, then typically when I'm seeing them back at like 3 months and then 6 months and then yearly, they're holding their patterns. I have many people at this point that I'm seeing only once a year for check-ins, and most of them continue to be symptom-free. Their muscle patterns look good when I go through and run all of my tests to see how things are working. Swallow pattern is going to change through adolescence, so sometimes that's something we have to retouch on. But in general, if we are comprehensively working, then we don't really see that muscle relapse. Now, if we see somebody go through a partial program and we don't get to the phase of creating that muscle memory, because it takes a while to create those pathways, then sometimes we do have that relapse where maybe we're not starting all the way from the beginning, but we have to backslide just a little bit to remind the brain so that we can pick back up where we need to go.
Yeah, that makes a lot of sense. So how would you know if you had dysfunction, like we talked about for kids a little bit, but what about adults? Like, how would adults know? Because maybe someone's
Adults,
listening,
the
like, maybe I have
biggest
to do this.
Yeah, the biggest thing that I see in adults is ortho relapse. So if they have to go through braces multiple times, they lost their retainer, now their teeth are crooked again. The retainer is just fighting what the muscles are trying to do. So again, we have to get those muscles cooperating with us. Could be TMJ issues. So we've got some muscle tension and discomfort from not working properly. And typically that's what happens where we compensate for a long period of time. And then eventually the body is just like, I can't anymore. And then we start seeing these big symptoms. And I know you see this when you do hormone stuff with people because the bodies can compensate for so long. And then all of a sudden it's like, nope, I'm out. I can't do it anymore. And then that's where we start seeing really bad TMJ problems or neck problems or snoring or sleep apnea, things that I never had when I was younger. So we associate it with you get older, you always get this. But
Yeah.
really, it's that we're compensating for so long, it usually will happen around this age.
I love how you brought up like neck pain because TMJ, people are like, okay, it's in the mouth, but like neck and shoulder pain. And you also brought up trauma, how trauma can make things different. So, can you, I guess, lean in a little bit more to that? Because for me, like, I have this like chronic neck pain, or well, not chronic, but like it will flare up every once in a while. And it started in medical school when I started
Mhm.
seeing a lot of traumatic things, right? And, and I went through traditional orthodontics and going through this training with my son, I do the exercises with him because I'm like, I don't have good tongue posture. And probably everyone listening doesn't either. But yeah, what is this connection with the muscles and with trauma?
So with trauma, there can be multiple, right? There can be emotional, physical, multiple different ways that we can have trauma in the body, and the body is going to register it and react to it in all kinds of ways. So say we have a physical trauma where this happened to me, maybe we get hit in the face with a baseball, walk up to the baseball field. First thing that happens is got hit right in the jaw with a baseball.
Ugh.
It was awesome. So there are things that my body has to do to heal from that. It's not just get my jaw back in place. It's, hey, these compensations that you learned over this last week from your jaw being out of place, we need to undo that. We need to work on the muscles and repattern them as we're undoing some of that physical trauma that happened. Or maybe it was a car accident and we have all of this stuff going on in the body and the body is reacting huge. We have to remember that everybody's physiology is different. So some people are going to be able to quickly move past things. And sometimes that car accident that seemed minor turns into major. And the fascial system is all out of whack. The nervous system is all out of whack. And there's so many things that are going into what's happening in this person. And so we have to really dig deep with everybody that we see. We start from birth, even in our adults. Like, I need to know about birth. I need to know about feeding when you're an infant. I need to know all of this kind of stuff so that I can start figuring out where some of this trauma could have been happening. And then we start working on it and compensations that came from it, and then pull in providers from my tool belt. I cannot do everything by myself. I have really good providers that help me to get everybody to this really good place.
Yeah. Yeah, that's awesome. So, what are some easy exercise? I mean, could someone just listening out there do a couple of exercises just once a day or to start strengthening their tongue or no? Or I mean, everyone should go see through a program, right? But
Right.
like, are there a
So
few like exercises that we could do?
really, like the biggest baseline thing is starting to learn to have lips closed, breathing through the nose, and then tongue posturing into the palate because we should be customizing everything that you're doing. It's hard to say, what I would need for exercises, what you would need for exercises, but those basic skills of lips closed, breathing through our nose, tongue posturing up gets us to a really good place. There's obviously ways to isolate all different parts of the tongue. And you'll see this as we get further in too, where we're isolating the middle tongue, we're isolating the back tongue, and we really get into like the meat of stuff that we're doing. That a lot of people are super inactive in that area, but I don't know how to fix it until I start seeing what's going on.
Yeah. So having that tongue at that posture up on the roof of the mouth, that is putting that pressure on the
Mhm.
palate to stay expanded. And if you're breathing through your mouth, the tongue is just like flopped down, right?
Yep, exactly. If your mouth open, even if it's not like huge mouth open, this is something that people get confused a lot too, is if we say mouth breathing, they are thinking
Right.
like, yes, obviously that falls into mouth breathing, right? But mouth breathing can be lips parted and still taking in.
Um,
And
mm,
so maybe it's not like a huge, large gape that we're seeing. Maybe it's something small and we're taking in that air. And then we're introducing bacteria, unfiltered air. Maybe we start seeing enlarged tonsils. Maybe we start having gut health issues because we're taking in the unfiltered air and we're causing a gut dysbiosis from it. There's like this whole snowball effect that happens. So if we can get
yeah.
to like a baseline of lips closed, tongue up, nasal breathing, we're in such a better place.
Oh, goodness. Can we talk about tonsils? Because it is so annoying, tonsils and adenoids. This is like your ENT will not tell you the root cause of your kids' enlarged tonsils and adenoids because they want to take them out.
Yep.
And I can just see their faces right now. I have patients that I have told them the root cause. We've worked on root causes, but I told them that it's an airway problem too, and they need to get an alpha device and they need to do myofunctional therapy and craniosacral therapy, and then they won't need surgery. But it takes work and it takes money. So we're just going to get surgery that insurance covers.
Yeah.
And I'm sorry, this is probably a rant, but I can't deal with it. It's so annoying. So why are the tonsils and adenoids enlarging in these children?
Tonsils and adenoids can be complex. And a lot of the times it's kind of the chicken or the egg thing. Like we truly don't know which one's coming first. But when I see people with enlarged tonsils, I work as if we started mouth breathing, having poor function, and or introducing things into the diet or something in the environment that is creating inflammation in the body. And then the body is trying to get rid of it. And then we have the enlarged adenoids tonsils happen. So we kind of work it from that standpoint. We are a very functional practice. So our goal is least amount of interventions as possible, and we try to get the body functioning well before we start making those decisions. One thing that a lot of parents don't know, and ENTs are not telling them, even if they are taking out adenoids and tonsils, is that adenoid tissue is going to regrow. If we are not figuring out why it was enlarged in the first place, or trying to correct if we do know why, then we set ourselves up for having to repeat this surgery over and over. Tonsils are not, those are going to be gone, but the adenoids can affect the airway just as much. They can completely cover up the breathing space. So when we are seeing this happen, we really need to try to dig deep into this and say, okay, what's going on in the diet? Like who can we use as a provider to try to figure out what sensitivity there could be being introduced to, or what's going on in the environment? Do we know we're allergic to cats and the cat's sleeping in this bed, right? Like what's going on with this person? And then what's breathing like? What are we doing as far as breathing? Are we open mouth breathing, taking in that unfiltered air, which is causing the tissues to get inflamed itself? Then the bacteria that's harbored back there, and this whole thing starts happening. And so there are protocols that we can use to just start a couple of easy supplements and things like that, just to start shrinking those areas. And then also, how much space do we have? So if
Right.
we are super narrow like this, even a normal sized tonsil is going to take up space. Like we
Mhm.
need to make sure that we are looking at all of this stuff. What does the Mallampati score look like? How high is that tongue in the airway? What is going on with this person to cause all of this stuff to happen? Because if we're covering up the airway with the tongue because we need muscle tone and posturing stuff to be worked on, then that person's always going to have their mouth open. And so, what are we going to do if we're not correcting that?
Yeah. And sometimes I feel like the airway is like so narrow that they can't even drain. And it's like you're working on all the root causes, but if they're not helping the air, like for more room,
Yep.
then it's just not going to get better either. It's just going to take longer. I think it's hard too because we live in a society where everyone just wants everything done fast with minimal effort. And I will tell you that is not how optimal health is achieved. It's just not. And like I said, like today, I drove 3 hours so my kids can go, see someone. I'm waking up, tomorrow and we're seeing you. I mean, it takes effort, but a little like this is a little effort now compared to the payoffs later. Cause I know mothers might be listening. They're like, wow, like my kid needs to start doing this. We have to start working on their airway. They need myofunctional therapy. They probably need like an airway, like an Alta device or Prozac or something. Yes, it's going to take time and money, but the bad stuff like braces and just the cosmetic stuff and not fixing the root cause or them having sleep apnea, like my husband's dealing with, in his 40s, that is
Okay.
worse. And that is more expensive. I promise you. And,
It is.
sleep apnea in general has really high morbidity and mortality. And we see the studies that leads to obesity, it leads to chronic illness and disease and heart attack and just heart failure and diabetes and all of this. Because if you're not sleeping, then your body can't repair and your cortisol is going to be up. So a little bit of effort now when your kids are young, and I just keep telling myself, and I joke with my kids and I'm like, especially Emery, I'm like, your wife is just going to be so like happy that you don't snore. Like, right?
Yeah.
Yeah, I mean, what do you tell like the parents that well, and you're so kind too because the first 2 weeks like we just slacked on exercises, and you're not going to be perfect at it. So like what do you tell the mothers or the fathers out there that they're like, my kid probably needs this, but I'm scared of the time investment or I can't do it. Like what do you tell them?
What I tell most people is, especially in the beginning, like every habit of doing thing, it takes time. So when I see people, and I've only seen them once or twice, like I really do not expect perfection. What makes me happy is when I go back to retest things, if those pathways are starting to be created and the muscles are starting to function differently, I find that to be a win. That means that we are still progressing, even though we weren't perfect. And so I tell a lot of parents if there are days where I personally give exercises twice a day, usually, where you get one time a day, do it once a day. That's fine. That's better than not doing it at all. It would be kind of comparative to if you're going to the gym and you want to hit twice a day, but you can't twice that day. Doing it once is still going to be beneficial. Like we can still see change. And a lot of people are like, oh, well, these exercises, there's too many or they're too long, or tell the person that you're working with because we have so many different ways that we can do exercises and give things that if what we're doing and the way that we like traditionally like to do it is not working for you, then let us know because everything can be altered and customized to you if you're seeing a myofunctional clinic that knows how to customize to the person.
I love that. I love that because it is so important. So I was talking about this in my Instagram stories about like tooth pillow. Like I keep seeing all these mom groups, like they must have ambassadors or something. And I'm like, eh. And I asked Chelsea about it. And yeah, we need to spill the tea about the tooth
Yeah.
pillow.
So Tooth Pillow is a platform and it helps to pair parents with providers. Most of the time, it's providers that are nearest them. And what they'll use is that provider will either use a MyoBrace appliance or they'll use a Vivos Kids appliance, which is basically kind of like a football mouthpiece, is what it is. So it props the kids open. It is a little bit rigid, so it does help a little bit with movement, but really what we're seeing a lot of the change from is the muscles changing. So the tongue coming up into the palate, kind of like what we've been talking about training the body to do. In our area, the Nashville area, we have so many really good airway providers that if we suspect that there's something going on or we need expansion, it's so much better to go ahead and go straight to that provider that can help with the true expansion and not do that first step and possibly waste time depending on how old that child is.
Yeah.
And MyoBrace has been around for a long time. When I first started, and I'm sure Vivos Kids has too, but I've been more trained in the MyoBrace stuff. And it's not that we never use them. We can use them in different cases when indicated, or if you're in a rural area where you don't have access to care, it's definitely better than nothing. But they do use a system where they are having people promote, and then there's codes and are sharing payment and, things like that. So in my opinion, just because I've been in the field for so long, going straight to one of your trusted airway providers is the best way to do it. It's going to ensure that you're getting definitely every single thing that you're needing. Nothing's getting missed at all. You're having the highest level of care and customized for that person.
Yeah, the MyoBrace, I heard that it can help, but it's like a compliance thing with the children too.
That's the biggest
Okay.
thing that anybody that I've ever worked with them in. Now, it's not everybody. So there are people that are just the most compliant people in the world. But in general, for those type of devices, we want them being worn all night long through sleep and anywhere from 1 to 3 hours during the day, which can be difficult. I mean, to be honest, like even myself, I would not be able to be compliant with that. Maybe nighttime, but daytime, absolutely not.
No, I like chuckle when I think about it. I'm like, have
Yeah.
fun. Especially if you have multiple kids. Yeah.
Yeah,
What the fuck?
it's tough. And
Yeah.
I even tried one of the appliances for my own 4.5-year-old, and
Mm.
it's one of those battles that for her type of personality, there's no way that
Yes.
that I could get her to wear it for more than 2 minutes.
Right.
So,
Right. Yeah. Let's pick our battles here. That's tough.
yeah.
Yeah. Well, awesome. I'm glad we cleared that up. And we definitely want people to get the best care and go to airway providers that have training in a lot of things, because they should have many tools in their toolboxes, not just that one tool, not just the MyoBrace or not just the ALF, but like the Prozac and all that. So I think that that's important. And also training when you pick a myofunctional therapist, that they have lots of different trainings and different experience, because this is like what I tell my patients. Like, I have a plan A to Z. I have so many tools in my toolbox because not everyone needs the same tool. So just make sure if you're investing, check reviews, check people that, if you're hesitant, I'm sure they have a couple of patients that would talk to you about their experience. So look for that, because that's really important, especially because it is a financial and time commitment.
I fully agree. And we try to have people do reviews for us. Very few do out of, the hundreds that we see, but at least like the really important, like, hey, this case is kind of special. Why don't you give a review about it? So that way when parents are looking for somebody, they can say, oh, this is what I'm dealing with. This probably would be a good provider to go to. Because, I could talk till I'm blue in the face about stuff, but really, if you have that validation from another parent that's gone through the same thing, that just holds so much weight for people.
Yeah, it really does. And I will tell you that most of the doctors that are very good at what they do are bad at marketing and asking for reviews. Like, that is a good reminder. Like, I was just thinking today, I was at someone's office and I'm like, oh, like they do this whole reviews. I need to get better at that. So if you're listening, once again, please leave a review and we'll read your review online. Or I don't know, it's hard, but I try to review businesses that I love. Well, we're going to move into the lightning round real quick here. Okay. You
Okay.
ready? Okay.
Maybe.
So what career did you almost choose?
I would say vet.
Oh, I could see
Veterinarian.
that.
Yep.
Yes.
Yep. Being an animal caretaker.
Well, you are so good with kids. So I'm glad that you are working with people instead of animals. Okay. What is your favorite habit that rescues a tough day?
I'm really okay. So we live in a farm, and being with the animals. My favorite animals are goats, and I have this one chicken, Thor, that will cuddle, and just using the animals as therapy, being out in leaving my phone and my devices and being outside with nature. There's nothing that can compare to it.
I love that. I love that. But I now don't leave my phone when I go to the cows because of when I had persimmon take off and I chased her
Oh
for
my gosh.
or without, and I didn't have a phone. But the good thing is my son saw me like run off. So he knew, but he didn't know how to locate me. So anyway, that's why I still bring my phone when I'm with the cows now. But
Yeah.
yeah, I agree. Being out like on our mini farm, we love that. What is one wellness rule that you'll happily break sometimes?
Ooh, that's a tough one. I think wellness rule. That's a tough one for me.
Like mine is I still enjoy a really nice old fashioned.
I think I'm going to say it. Okay. Nobody
Okay.
judge me.
We won't.
But the seasonal Starbucks drinks.
Okay. I thought you were
No.
going to say like crumble cookie or something. Then I would judge
Oh,
you.
no,
But
I
I'm
don't.
glad. Okay.
No,
That's not
no,
bad.
no on
Like
that.
like a peppermint mocha or like
Yeah, I just get so
yeah.
excited. Like there's some
Yes.
kind of nostalgia about those types of things.
Yes. Yes. Oh, I love that. And last one, and it's one word only. What is one word you want listeners to carry on through their week?
Love.
Love. I like that.
Love is such a good one. Love yourself, love your friends, love your neighbors, love your family. It's something that we can forget often. People that we are closest to tend to get the least amount of our love. So, love, I think, is where I want to leave people.
Yes, love on that. And love your airway. So
Love your airwell.
how can everyone love their airway? So this episode should come out right before you have a big day at your new place. So tell everyone, because I'm sure we have some Nashville area listeners.
Yeah, so we are opening a new wellness studio in Mount Juliet. It's called Vitalis. It's going to be a cold plunge, sauna, contrast therapy rooms, salt room, and then a Dahlia red light bed, which is a medical grade red light bed that gets to the mitochondrial level and can do various things. That is where our Mount Juliet Breathe Well office will also be. And we will be opening within the next 3 weeks or so. And we're super excited to be able to serve the community in this way because this is something that's really lacking in our specific area. So we're pumped. We'll have different membership options, drop-in options. We're doing founding memberships right now. So they're on a big sale right now for people. Just really excited to be serving the community in a little bit of a different way also.
That's awesome. And how can they go to a website or Instagram or how can they find out?
Yep. So it's Vitalis every day because we want wellness to be every day. We want this to be a communal thing. So you build community here, and every day we're investing in ourselves so that we can fill our own cups in order to pour into other people. That was our vision. So searching Vitalis every day, you can find our website, Instagram, Facebook, anything like that. We're doing lots of heavy marketing right now for different events and things coming up. So be on the lookout for that if you are interested in anything wellness.
Awesome. So thank you so much, Chelsea. I hope y'all learned a little bit about myofunctional therapy and that hopefully you'll go see Chelsea. Well, don't get her too busy. I still gotta get my kids.
Yeah, and you guys can always find me if you go to our website, thebreathewellgroup.com. You can schedule directly there. We see people in person, Franklin, Tennessee, Mount Juliet, Tennessee, Murfreesboro, Tennessee. And then we also offer lots of virtual options for those of you who may not be local or maybe a little bit further away or just busy and can't invest the time to drive to the appointment but want to have the appointment. That is another way that we can serve you.
Yes. Awesome. Well, thank you so much. We appreciate your knowledge.
Great. Thank you.